have 7 new cases in British Columbia to tell you about, which brings our total to 39.
Will we run out of space for isolation? As 7 more cases of COVID-19 are announced in BC, do we have enough space for those needing to be isolated in hospitals?
That's a very good question, and that's something that we obviously are monitoring.
With the province hitting nearly 40 cases of the virus, Dr. Bonnie Henry explains how the healthcare system is prepared to handle patients in hospitals.
The minimum that we want is a single room for somebody, but if we start to have a lot of people who are ill with this, we can do what we call cohorting. So we have rooms that people with the same disease can be in. So there's lots of plans for looking at that, for scaling up.
2 of the 7 new cases of COVID-19 in BC come from unidentified sources of exposure. 3 are related to travel in Germany and Egypt, and 2 are from the Lynn Valley Care Centre, the source of the first coronavirus-related death in Canada.
There's been a number of testing being done on people with symptoms, and there are no new cases in residents of the Lynn Valley Care Centre, so that's good news.
BC now will ask anyone returning from Italy to self-isolate for 2 weeks. This is the same request for people returning from Iran and China's Hubei province. And just to clear things up, here's what you should do if you think you could have COVID-19 symptoms.
And anybody who has symptoms feels that they need to be tested for this, and that may not be the case. So we advise people, if you have symptoms, to self-isolate, stay at home. If you have symptoms that need medical assessment, call ahead. And if you do have concerns about COVID-19, call 811 or call your healthcare provider ahead of time, and they'll be able to direct you to where you can safely be tested.
The federal government is set to lay out its plans in response to the virus on Wednesday. In Vancouver, Ashley Burr, City News.